what time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Big game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing that. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Huber, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we when we link up. Let's go. Yeah.
Y'all ready for this? Yeah.
This is the Lisa Baxter Show, giving you the 411 and the kidney one. My girl, and say, this is.
You know, when I went to the dentist, they told me when I was on dialysis that I couldn't go the same day as dialysis. I didn't know why at first, you know, they was just told me that I couldn't, because of the heparin. I couldn't have heparin the same day. And I remember last time when they pulled my tooth, I bled a long time. I didn't know what was going on. And then when I got the transplant, they made me take all of these different pills. I mean, they gave me antibiotics to take then. So, I don't know what to do. I suffered from low calcium, and I lost some teeth, and I got swelling in my gums. And it bothered me and hurt. Is there a dentist in the house? Wait a minute. I heard on the Lisa Baxter Show tonight that there will be a dentist because this is the Lisa Baxter Show, giving you the 411 in the kidney world. Hey, everybody, happy Sunday. Oh, I had such a good time in church today. It's our 42nd anniversary, New Life Cathedral of Brooklyn. I wanted to share a few things before I put my guest on. I got a new shield. I think it's sweet. It even fit with my glasses on. How y'all like it? I still have my mask on with it, but I see people sometimes don't have their masks on with it. But I wear it with mine. Extra protection. All the protection that I could get. And I finally invested in one of these to wear around my waist in case I wanted to fit my phone in here or put little things in here when I don't want to really carry a big bag on my pocketbook. So I was like, wow, this is like cool. And I got it for a reasonable price. Yes, I did. Yes, I did. This is another goodie I found to regulate my blood sugar, to be able to not only stick myself, but count. And they even have a team up for diabetes team.com. So it's teamupfordiabetes.com. See, I will put it in the chat later. So if you are diabetic or anything, this team is good for you, and so many other things. The American Association of Diabetes Association, also wonderful as well. One more thing. Look at that nice recipe. Doesn't that look scrumptious? Yeah, it's a chicken fajita from the National Kidney Foundation. And it only got a couple of little recipes, ingredients in there, and it doesn't take that long to cook. It's colorful, pretty, delicious, and healthy. I wanted you to know that. All right, so push that share button. Our question for today is when a person is on dialysis and they miss treatment, what is some of the issues and problems they have because they are missing treatment? Put it in the comment box. Let me know what you think. That's the question for the day or the question for the night. How about that? Well, without further ado, I would like to introduce my guest. I have a doctor, Delroy A. Brown, DDS. He's a dentist. Is there a dentist in the house? Yes, there is. And we're going to ask him some questions, and we're going to work with him on tonight. How about that? Welcome to the show, Dr. Brown. Woo-hoo! All right, Dr. Brown, how are you?
I'm doing wonderful. How are you doing?
Alive and kicking, alive and kicking. Welcome to the show. Welcome to the Lisa Baxter show. I waited so long to get a dentist. Oh, man, and I'm so glad to have you and see you. So we're going to get this show on the road. Before you know it, the show goes fast. So have fun with it. Be yourself and spread some knowledge. Okay? All righty now. Now, before you did your job as a dentist, did you have a job or hold any other positions before that, sir?
Well, I was in the military, so I was a medical service officer, and I ran like a treatment platoon hospital type of setup for the National Guard.
Wow. Impressive, impressive.
And then I went to dental school,
and
I became a dentist.
Wow, wow. So how was it doing your thing in the military?
I just retired in 2019 after 34 years.
Wow, woo, that's a long time. Well, whoop, whoop. Congratulations to you.
Most of my adult life.
I'm sure. I'm so sure. Okay, so what made you pick the profession of dental care?
Really, I didn't know what I wanted to do when I was in college. I majored in pre-med, and I got kind of aggravated filling out the paperwork because I had all the different specialties, medical, optometry, dental, podiatrist, and the paperwork kept asking the same questions over and over and over, and I found it very annoying. I'm like, if you asked it on page 1, why are you asking it on page 6 and page 10 and page 12? So what I did was I put all the specialties on a wall and I threw a dart, and the dart hit dental, and I applied to dental school.
Oh, so by chance, boop, and that was it.
And that was it, because no matter what type of doctor I would have been, I would have given it my all. So the dart decided my choice for me.
Wow. That's cool and humorous at the same time. I don't know how many people did that, but you never know, right? So I got one right now. Well, okay, so you're a dentist and you live in New York as well, right?
Yes, I'm in Brooklyn.
Mhm, mhm. Yeah. So, what would you say the hardest thing about your practice is?
The hardest thing is
Hmm.
not the work.
It's not the work.
It's
Okay.
the it's the personalities and the expectation. I'll give you an example. I had a
Please.
I had a patient come into the office. She was 48 years old. She brought a picture of herself when she was 17 and said, make me look like this. And you know, my response to her was, I will do the best job I can, but only God can make you look like that. So it was uh it was an experience.
So you do cosmetic dentistry as well? You do it all
I
when it comes
do
to the mouth?
I do cosmetic, I do orthodontics, I do
Hmm.
oral surgery, general dentistry. I don't do implants.
Okay. All right. You don't do implants. Okay. So, all right. So if I walked into there and I told you, well, that I had kidney disease, I was on dialysis, but now I have a transplant, and my gums are swollen, and I couldn't get the swelling down for any dentist to treat me because they can't get to the teeth because my gums are so swollen. What advice can you give me if you're allowed to say this?
Well, the first thing I would do is I would do a thorough medical history
Mhm.
and find out, how long you've been on dialysis. I'd find out about your diet. I'd find out about your medications, because some medications that you take can cause swollen gums or puffiness. So once we rule that out, then we look at evaluating your oral health and taking in a look at the structure of the teeth, the bone, the gums, to see if there's anything that could be triggering that type of reaction.
Mm. That's a good one. Keep going. I mean, don't
And
let me interrupt you.
and and if you listen to the patient, most of the time, when a procedure comes up, sometimes patient walks in, doc, I have pain. Well, pain could mean 10 different things. So you sit there and you just go old school. You sit there, you ask questions, and from the questions, and if you listen to the patient will tell you what the problem is. If you have, appropriate diagnostic skills and listen, and then from that, you can break it down to one or two things. And then from the one or two, you can rule it down to something specific, with x-rays, exam, and medical history and and patient history. That that usually solves the problem right there.
Mm. I like that because I like the doctors. I used to go to ones that catered to cowards. So even though I went every 6 months and I got my cleaning and all of the stuff, I've always had different issues because I had low calcium and stuff like that, and I had all kind of things dealing with my mouth. But I said that to say this: you talk soft and you were calm about it, and you know what you're doing. A lot of times, a patient loves that when a doctor knows what they're doing and they're not rough with them and they're gentle about it and they hear their story or their side of it or their history or what they're dealing with. Now, have you, if have you, because I know when I was on dialysis and I went to the dentist, they didn't let me go the same day that day that I went to the dentist. I believe it's because of heparin. Did you or do you ever experience that?
Yes, I do. I have patients that have had transplants
Mhm.
that are on dialysis, and they come to alternate days. I make sure that they get their pre-op medication, because you don't want anything, that you do that can affect, your 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 overall health. because the oral cavity is very toxic, believe it or not. You know, when scientists look at the oral cavity, they measure the amount of bacteria that's in your mouth, and from the other end of the digestive tract, they measure the amount of bacteria that comes out the other end, and they find more bacteria in the mouth than the anus. You know,
I
so
heard that too.
the mouth can be very treacherous. And
Wow.
another thing is the your body, your oral cavity is not really a part of your body. It's a tube inside you. Food goes in, waste comes out. And what your body does is your body takes in what it needs in nourishment, minerals. So if you're low in calcium, your body will pull the calcium from your teeth because your teeth is not recognized as part of your body. Yes, it is a part of you, but it's part of the digestive tract. And anything that you eat in the digestive tract, your body will have to absorb. And it's hard to get that into patients that you are what you eat. Literally, you are what you eat.
Yeah. Mm. Well, I'm glad you said that. You know what I mean? A lot of people eat different ways. You know what I mean? You know, some are vegan. You know, some eat bad or unhealthy, and some eat very healthy. So I guess you run into them all. I'm glad you're knowledgeable about people on dialysis or with transplants. Because when they kept giving me those antibiotics to take with me when I go to the dentist, I didn't know that I would have to do that, but that was something new. And I was glad they told me that, because when I walked in one time, the dentist said, if you didn't have those antibiotics, you cannot come in here. And I was like, oh, I'm sorry. You know, I didn't know. I wasn't trying to be disrespectful. I just wasn't aware, you know, but I'm glad you said that and broke it down. You know, people are afraid of dentists a lot, and people are nervous about them as well. I mean, how could you slow down their fear, or what can you do to help them to be so afraid? I know the drill, ying, 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 you know, and that long needle, you can feel it going all the way up into your head. I always remember that, even from small. But every time I'm nervous every time I go, but I would make myself go. Even if I cried in a chair, which I usually did, I used to tell the dentist, keep going, don't pay no attention to me. You say keep going, you know. But what would you do to help a nervous person, a fearful person, or people to stop being scared? Because some people just let the teeth fall out and everything go rotten. That's how afraid they are. You know what I mean? I care about my looks, and I would have wild without my partials and doing this show, and I've been embarrassed about that, and I hate it. But I did it. I'm just real with myself. But you know, what would you do in the fear of this person or people?
Well, I always tell patients that are very fearful. I like to deal with chickens. You know, chickens are okay, but guess what? I break it down into a simple analogy. If you had a car accident, does that mean you're not going to drive again? So I always say, hey, you went to the dentist, and you went to a dentist that may not have had the skill or the confidence or gain your confidence. So what happens is now you're blaming every other dentist for what that one dentist did. You know, and I make the analogy as, you know, as kids on the block. Kids on the block, oh, I know this, I know that. And they're telling each other things that they think are so. And sometimes patients listen to other patients that really don't know what they're talking about. And they take on their trauma by listening to things that are not real. You know, and from that they become traumatized just from, you know, it's like a soldier that goes through a battle, PTSD. But now you're getting that from listening to someone that was traumatized. So you take their trauma and you internalize it. And sometimes I talk to patients, I'm like, have you ever had a bad experience at the dentist? I'm like, no. I'm like, well, why are you afraid? Oh, because my friend told me. I said, your friend could have told you anything, you know. And the analogy I give is kids on the block talking about sex. You know, they don't know what they're talking about, but they're talking about it, and
Yeah.
they're spreading it, and people are listening, and they're taking it as gospel, but it's really ignorance. And from that,
Wrong
the fear
information.
builds
Huh?
up.
Hmm.
So what you have to do is educate, be gentle, and get rid of the fear through open, honest communication.
Yeah. Yeah. That's wonderful. That's good. I mean, I'm feeling calm and better about it. You know what I'm saying? Now, what would you say your success story is, if you had any success story? Whether the person was fearful or had I don't know what you had to do in their mouth. You can even give us some examples of some of the things you do inside of a person's mouth, or something you had to improve upon, or any success with that.
I mean, I've been practicing for over 25 years. I've had many
Oh yeah.
success
Woo.
stories.
Hallelujah. I ain't mad at you.
So, you know, so patients that come in with gum disease, uh, patients that come in with malocclusion or abnormal bites, patients that come in with missing teeth, and I've had to make dentures or partial dentures or do multiple extractions. I mean, the most extractions I've ever had to do one time was 15 or 16. And what we did was we did the 15 or 16, and we did a full mouth reconstruction. So when the patient walked out, the only person that knew what took place was the patient, because they walked out with
Wow.
everything in,
Ooh. Okay.
you know,
All right.
and that requires a lot of pre-op work to make sure that
Mhm.
everything is fine, everything is measured, and then what you do in the pre-op, you do in the surgical, so that everything is customized, so that everything fits.
So you deaden them, or do you put them to sleep?
I don't put patients to sleep. I have a conversation with patients, because a lot of times the fear itself, once a patient has the anesthesia, they can't really feel anything. They can feel you, but they can't feel pain. Anesthesia doesn't stop you from feeling. Anesthesia stops you from feeling pain.
Mm.
And once you
Wow.
explain that, and they trust you, you know, like a small child. If you lie to a small child and say, "Oh, this is not going to hurt," and you give them something and it hurts, they'll never trust, never open up for you again.
Mm.
So when a small child comes in, I said, "How is this?" I said, "You're going to feel a pinch." I never tell them you're not going to feel anything. You're going to feel something, and when you feel the
That's
pinch, after that, everything is going to go. It's going to feel heavy, and
mm.
you're not going to feel anything. And then I go back a couple minutes later. I said, "Did I lie to you?" And they're like, "No." I said, "Did you feel a pinch?" "Yes." And then from that, I had their trust. And once I have their trust, I could just do whatever I want.
Well, people love the truth. You know what I mean? They love the truth and love you to be upfront. You know. Well, let me see. Okay. Have you dealt with people with different illnesses? I know I talked about kidney disease and stuff and transplants, but I know you have to probably deal with people with heart issues or any other type of issues, or maybe
Uh,
even special needs. Somebody might be dealing
uh,
with a disability.
yes, I used to be president of a organization like Doctors Without Borders,
Hmm.
and we would go into countries, and we would do physically challenged patients. We bring them into the OR, put them to sleep, and I would do like a full mouth reconstruction on their mouth. I have training with that. Uh, I've worked with cancer patients that need apparatus after surgery. I've been part of the cancer treatment team of many patients, because oral health affects your immune system. So in order to make sure that someone has a good immune system, a dentist is usually part of the medical team that's there, because before anyone starts chemo or radiation, you want to make sure that everything in the mouth is good, because the dental tissue is very sensitive to radiation. So you want to make sure everything is done, and then you have a window after radiation where you can't do anything, and so you try to get everything done before, and then in that window when you can't, and then there's another window when you can go back in and do procedures that will help the patient to heal. But if you work on a patient during the window when their healing is compromised, then chances are they're not going to heal, and that's not good.
Wow. Okay. Well, you sound very knowledgeable about what you're doing and how you do it. And I do appreciate that. You know what I mean? I'm sure that the people out there appreciate it as well. Breaking down this thing, talking to them and stuff like that, giving them hope or giving them courage for the ones that don't have it, or the scaredy cats, the chickens, and things of that nature. So I do understand that. Well, I want to ask you something because we're about to end the show. If there's anything that I forgot to ask you, or anything you want to mention, you have any of your instruments that you want to show, or your coat or your uniform or anything of that?
I didn't bring any of that because that was, I thought that would be like so routine. But one thing I did bring was a mask. Why? Because COVID is real. and the Delta variant is real. So, I just want to stress to people that you have to really protect yourself, because in the field of dentistry, not much has really changed for us because we've always been geared up. We've always had masks. We've always had shield. We've always had protection. And with COVID, it's just a matter of ramping it up just a little bit more. So it's
I'm glad you're protecting yourself.
That you take care of yourself, and that's very important.
Wow. Well, I'm glad that you are able to deal with. I don't know if you had anybody in the chair that had COVID and you might not know, or maybe they signed a paper or something like that. I mean, because I know they ask you that. They ask you that for everything. I get on special transportation. They ask me, do you got COVID? Do you have any symptoms of COVID? Have you ever had it? All kind of stuff like that. Well, and unfortunately, somebody gave it to me. I was careful the whole time. I was doing so good. I was proud because I didn't go out for a couple of months because they told me not to, blah, 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 working from home. But then I got it from somebody young that was a little on the careless side, and they gave it to everybody in the house. So I said that to say this. I had to answer those questions when people ask me. Usually when they said it, I go, no, But then when I actually got it, I go, well, yeah, I had it. You know what I mean? Or I'm honest about it. I'm not, I did a whole blog on it because I wanted people to understand and see what I was dealing with and what people deal with, so they would take it more serious and they wouldn't have to go through that terrible experience that I went through, almost losing my kidney and everything, and could have died. So I just glad that you protect yourself and that you're saying these things about COVID, because you're still working amongst what's going on.
It's great, but the one thing that I didn't mention is the way that I practice dentistry. I practice dentistry holistically because you could say, okay, the teeth are just teeth, but the teeth is connected to a person. The person is going to have medical conditions, and if you don't know how to deal with those medical conditions, then you really can't treat the person. So maximizing the patient's knowledge and education and doing it in a holistic way, because the teeth are attached to a person. So that's number one. You got to treat the person, and every person is different. So every case is different every single time.
Well, you're right. The teeth is attached to the person. Even the ones we got left. So I know that's right. Being a social worker, when I was a social worker, you do have to deal with people, and you have to deal with them accordingly. No matter what you're dealing with or how you feel. And I like that, I keep talking about how soft-spoken you are. Have you always had that demeanor where that gentleness? Because I'm telling you, people need that. The more nicer they was to me, the more they got me to do stuff. You know what I mean? When I didn't want to get in the chair, when I didn't want to go to dialysis or I had problems, they said, come on, Lisa, so they knew how to get me. And I like that because I know how to get my clients too. You know what I mean? You start to know the personality when you have them all the time or had them for a good minute. But also, sometimes you can read a person too. You don't want to read them wrong, but I'm just saying, sometimes you can read a person. So I like the fact that I'm dealing with you according to you or how you want to be dealt with. I might have to ask you, well, how do you want me to treat you? Do you have to go into that type of thing, sir?
Yeah, well, I always tell patients the only dumb question is one that you don't ask. Because if you leave the office and there's a question and you go home thinking about it, why? There is no dumb question. Okay? Mm-hmm. There is no dumb question. When it pertains to your body and your health, there is no dumb question. Knowledge is power.
Is there any special way to brush, or is there a special type of toothbrush you need? I mean, because I'm old school. I got the electric one and I got the regular one. I mean, okay. I got it all. Even though my teeth is the way it's acted, I've done so many things to help it, and the floss, you name it. Is there any special instruction or something you could tell us, give us a little tidbit?
My mentor always told me, brush and floss the teeth that you want to keep.
Oh, wow.
If you don't brush, don't floss, they're not going to be around very long. And the type of toothbrushes that you should use are soft and extra soft. And you should be as gentle as possible. Because let's say you have a cut on your hand. I like to use analogies. If you put salt in that cut every day, will it ever heal? Answer is no. So if you take a toothbrush and you're scrubbing like you're washing a basin or dirty clothes by hand, and you're scrubbing, remember, the tissue is alive, the teeth is alive, the gum is alive. If you're scrubbing it like that, it's like you're taking sandpaper on a freshly painted wall, and you're taking the fresh paint off. So the secret to health is, one, go to a dentist. I don't care what dentist, any dentist, okay? Go to a dentist at least once a year. It's recommended every 6 months, just for the maintenance, because a lot of people complain about how dentists are expensive. But if you go in and catch the problem when the problem is small, it's very small money. If you let a $50 problem to become a $2,500 problem, if you let it sit around. But if you catch it when it's small, guess what? You don't even think about it. So the problem is, don't let problems linger and get gigantic beyond your scope. Once you don't do that, maintenance is important. You buy a brand new car, you change the oil every 6 months, the car lasts 25 years. You buy a brand new car, you don't change the oil, in 2 or 3 years, the car is dead. And people put more effort into their belongings than their body. Your body is more important than the clothes, than the car, than the shoes, than anything you can purchase. Because there's only one of you. You're irreplaceable, but those clothes, shoes, and car are not.
Wow. I like that. I like that a whole lot. And that's easy. I'm glad you said that. Some things is easily said than done. I know people that have bleeding gums and they try to make them stop bleeding, and loose tooth in the back. And I mean, I never thought a tooth can get loose in the back. I can know about a front tooth getting loose. I remember my father used to put the string around and slam the door to pull it out. And I used to, but we talking like way old school. I knew that'd get you to laugh. Look at you. All right. I ain't mad at you. Shando. But you're a fantabulous doctor. You seem to care about the people and care about what you're doing. And you took time to do it a whole 25 or 34 years or something. You said, what did you say?
34 years with the military.
I ain't mad at you. I know I got one of them numbers right. But, but I am glad that you came on the show. I'm glad. Is there any question or anything you would like to say that I did not ask you before I let you give your shout out? Because I want you to give your shout out to everyone to give, and any encouraging doctor that maybe want to take the same profession that you took as a dentist. What advice can you give him, or something you can give him?
Well,
Or
I
her.
would say, follow your passion, but there's a caveat to following your passion. Make sure that your passion can also take care of you financially, because as passionate as we are, we live in a world with others that has expenses. So you can always turn something that you love into your career, and that's the best thing to do, actually, because 50 or 60% of people hate what they do. If you love what you do, then you find joy going to work. And when you look at college is a good thing, but college is not for everyone. There's trade school, there's professionals, there's other schools that you can go to where you can learn a craft. But at the end of the day, if you don't go to college and learn a craft, you still have to educate yourself and read and get knowledge. Because knowledge is power. But college is not everything, and college is not for everyone. But if you're going to go to college, do something that you love. Because when you look at colleges, they have, let's say, 300 majors. When you get out, there's 100 jobs. So you're trying to fit a round peg into a square hole. That doesn't work. Unless you're in the healthcare field, then what you train for is what you do.
Yes.
But if you're not, that's not the case. Round peg into square hole does not bring joy.
Wow.
Does
Well, they
not
said
bring
if you work
passion.
on a job you love, you never worked a day in your life.
That's right.
But
That's right.
yeah. Well,
I got
who
that
would you
from my
give me a
mother.
shout out to? Huh? I'm sorry.
I got that from my mother. My mother taught me that.
Oh, good to get something from mom and dad. Oh, they're gonna tell
And
you stuff. Even grandma, they all gonna
and
tell
my
you
wife
something.
and my wife.
Yeah, you never
But
forget
but
it.
but you said it. My wife, my mom, and my grandmother. Three important women in my life.
Yeah.
Women have been holding it down forever.
They have. They have.
Yeah.
Yeah. My husband, my siblings, because I'm mad close to my siblings, my archbishop. So I know where you're coming from. You get those people that help you, support you, and speak into your life. So well, bless your life. Well, who are you giving your shout out to before I end this show? I see the clock over there. Mm-hmm.
My wife.
Mm-hmm.
She's there, and she supports me with everything I do. And I'd like to say that my kids are my next joy, and they're a blessing. All their different personalities. They're a blessing.
Well, that's fantastic. I thank you so much, Dr. Brown, for being on the Lisa Baxter Show. Keep doing what you're doing. Keep loving on your patients and people and working through the community. Because I know if you were in Brooklyn got a good thing going on over there, and it's you. And thank you so much. I work in Brooklyn and go to church in Brooklyn. We got to talk because I could, we do health fairs, job fairs, and street fairs, and I see you the man for that. Okay, so thank you once again. And have an excellent, fantabulous night. And thumbs up to you.
Thank you. Have a blessed one.
You too, sir. Good night.
Good night.
Well, guys, you have heard it from the dentist himself. I hope it calmed some fears. I hope it changed some minds, and I hope it encouraged you to go. Pray for me too to go. You know what I mean? I'm ready. I just had to find the right one. I ain't mad at you. I didn't get a chance to ask him about the sugarless gum. I had it somewhere over here. Yeah, the sugarless gum and the diabetes lozenges and cough drops and stuff like that. But I guess you got to do everything in decency and order, and but if there's any issues, bam, it gotta go. But you guys, V for victory. See you next week. We got 4 more shows to go. Thank you for your love, your support. Make us go viral. Sharing is caring, and blessings is out there for all of us. Good night. Peace. Mwah.
Y'all ready for this? Yeah.
My girl, and say,
This is the Lisa Baxter Show, giving you the 411 and the kidney one.
my girl, and say,
This is
brothers, my guys, know that they fly, know that they ride or die. I keep waves by my side, CJ Ike, now I gotta roll with ice. Cold, these brothers, my guys, know that they fly, know that they ride or die. I keep waves by my side, CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cold, these brothers, my guys, know that they fly, know that they ride or die. I keep waves by my side, CJ Ike, now I gotta ride or die.